At 2:17 in the morning, I saw a heart monitor change on a patient who wasn't supposed to have any brain activity left. I remember stopping in the hallway outside ICU room 12 and staring at the screen through the glass. It was a small change, just a slight rise in the heart rate line, the kind of thing that usually means nothing, except this patient had already been declared brain dead months earlier. My name is Dr. Dana Whitaker. I'm 46 years old, and I've worked in critical care long enough to know when something deserves a second look and when it's just a machine being noisy. Most nights in the ICU fall into the second category. Machines beep, numbers drift, and nurses roll their eyes because they've seen it 1,000 times before. But that night was different. The patient in room 12 was Madison Cross, 23 years old. Severe traumatic brain injury from a skiing accident outside Aspen 6 months earlier. The official diagnosis in the chart read, brain death determination under dispute, which is medical language for something that usually turns into a legal fight. Madison was the daughter of Vice Admiral Thomas Cross of the United States Navy. If you've spent any time around military hospitals or federal cases, you know that rank like that changes the atmosphere in a building. People stand straighter. Administrators start using careful language. Lawyers suddenly appear in meetings where doctors used to make decisions on their own. I wasn't the primary physician on Madison's case. I was covering the ICU overnight that week because one of our attendings was out sick. That meant I was responsible for the floor from midnight until the morning shift arrived. At that hour, the ICU was quiet in the way hospitals sometimes are. Not peaceful, just quieter than usual. The lights were dimmed, monitors were humming, and the night nurses were moving through their routine checks. When I walked past room 12, I saw Admiral Cross standing beside the bed. He had one hand resting on the railing and the other tucked behind his back, the way career military officers tend to stand when they're trying not to show emotion. Madison was lying motionless under the ventilator tubing. Her breathing was being handled by the machine, slow and steady. Her eyes were closed. Her chart listed her as having no purposeful neurological activity. The heart monitor ticked along at a steady rhythm. Then the Admiral leaned closer and spoke quietly. "Madison," he said, "if you can hear me, I'm here." The heart rate on the screen climbed by a few beats. Not dramatically, just enough to catch my attention. I watched it settle again. Normally, I would have kept walking. Heart rate changes happen for all kinds of reasons. Ventilator cycles, minor stimulation, electrical noise in the leads. But something about the timing bothered me. I waited another few seconds. The Admiral spoke again. "I'm not going anywhere." The line on the monitor rose slightly once more. That's when I stepped into the room. One of the nurses looked up from the medication cart. Her name was Carla. She had been on the ICU night team for nearly 10 years and had the calm, slightly sarcastic expression that comes from dealing with hospital chaos for a living. "Everything okay, doctor?" she asked. "I think so," I said. "Just checking something." Admiral Cross turned toward me. His face was tired but controlled. People sometimes assume military officers are emotionless. That's not really true. They're just good at keeping things contained. "Doctor," he said quietly. "Dr. Whitaker," I said. "I'm covering the ICU tonight." He nodded. I glanced up at the monitor again. Madison's heart rate had returned to its previous baseline. Carla leaned closer to the screen and shrugged. "Probably just artifact," she said. "Probably," I said, but I didn't leave. Instead, I looked at Madison's chart on the computer terminal beside the bed. The notes went back 6 months. Ski collision. Severe head trauma. Emergency airlift. Days of swelling and neurological decline. Then the entries that always stand out in a chart. Brainstem exam. Apnea test. Neurology consultation. Brain death determination. Except the phrase in Madison's record wasn't as simple as that. It said the determination had been made but remained under review due to documentation concerns raised by the family, which explained why she was still here. Normally, once brain death is legally confirmed, life support ends. But disputes happen. Families question the process. Lawyers ask for additional review. Hospitals slow things down. And the patient stays in the ICU longer than anyone expected. Carla noticed me reading. You thinking what? I'm thinking, she asked quietly. I don't know what you're thinking, I said. She glanced at the monitor. That heart rate thing. I nodded once. Probably nothing, I said. Then I looked back at the screen. If that moment made you lean forward a little, drop a comment and tell me where you're watching from. And if you like real hospital stories about doctors and nurses dealing with cases that don't make sense at first, subscribe to the channel so you don't miss the next one. Admiral Cross spoke again. Madison, he said softly. The heart rate ticked up by 3 beats. Carla noticed it this time. Her eyebrows lifted slightly. Okay, she said. That's interesting. I didn't answer right away. Instead, I opened the earlier neurology notes and started scrolling. One of the first things you learn in critical care is that medicine is full of patterns. When something doesn't match the pattern, it usually means one of 2 things. Either the machine is lying, or the chart is. I checked the sedation record from the week Madison had been evaluated. Something caught my eye. The timing of one medication didn't line up with the Brainstem exam. That didn't prove anything. Charting errors happen all the time. But it was enough to make me pause. Carla folded her arms and leaned against the counter. You're not thinking about calling neurology again, are you? I glanced back at the monitor. Madison's heart rate was steady. Normal, quiet, exactly what everyone expected to see in a patient with no neurological response. Except I couldn't stop thinking about the 2 small changes that had happened when her father spoke. I closed the chart window slowly. Carla, I said, do you remember if anyone has repeated a Brainstem exam recently? Carla tilted her head slightly as she looked at me across the workstation. Not recently, she said. Neurology signed off months ago. Her tone suggested the conversation should end there. But my eyes were still on the chart. Electronic medical records have a way of hiding problems in plain sight. When you scroll through them too quickly, everything looks official. Dates line up. Signatures appear where they should. Tests are listed in neat rows. It all feels complete. The problem is that medicine doesn't happen in neat rows. It happens in real time with people who are tired, rushed, or sometimes just trying to finish a shift without another crisis. I moved my hand on the mouse and opened the section labeled Neurological Assessment. Brainstem exam, I said quietly. Carla leaned over the counter beside me. Day 5 after admission, she said. Right. I read through the entry carefully. Pupil response absent, corneal reflex absent, gag reflex absent, apnea test performed, conclusion findings consistent with brain death. That part of the chart looked normal. Then I scrolled down. There was a second confirmation exam. Different physician. Same findings. Carla watched me for a moment. You're reading that like you don't trust it, she said. I didn't answer right away. Instead, I opened another tab and checked the medication administration record. Sedation medications are always listed clearly. Timing matters. When doctors test for brain death, they have to confirm that sedatives or paralytics are no longer affecting the patient. If those drugs are still active, the exam can't be trusted. Carla noticed where my eyes were. Oh, she said quietly. I pointed at the screen. Look at the timestamp on this. She leaned closer. Propofol, she said. Day 5, 2 hours before the exam. Carla frowned. That doesn't mean anything, she said quickly. Sometimes charting gets delayed. True. I clicked on the medication detail. Except the nurse entry says the infusion stopped right before the Brainstem exam started. Carla stared at the monitor. So the timestamp is wrong? Maybe. In hospitals, maybe covers a lot of territory. Sometimes a medication gets documented late. Sometimes the wrong time is entered. Sometimes a line gets copied from a previous entry because someone is in a hurry. None of those things automatically mean the diagnosis was wrong. But when you start seeing small inconsistencies, you pay attention. Carla crossed her arms. You think the exam might have been affected by sedation? I think it's possible, I said. She looked at Madison in the bed. 6 months later. That's the thing I said. Nobody goes back and checks. Carla gave a quiet laugh. That's optimistic. Which part? The idea that doctors check each other's work after the fact. She wasn't wrong. Medicine runs on a concept people outside the field rarely hear about. Diagnostic momentum. Once a diagnosis gets written into the chart, everything after that starts orbiting around it. New doctors read the note, assume it's correct, and build their decisions on top of it. Eventually, the diagnosis becomes less of a conclusion and more of a fact, even if the original step had a flaw. I scrolled further through the neurology consult. The EEG report was attached as a scanned file. Not unusual, but not ideal either. I opened it. Carla read the header out loud. Electroencephalogram report, she said. Yep. Performed at Ridgeview. That's what it says. She pointed at the bottom of the page. Signatures digital. Also normal. But something about the layout bothered me. The formatting looked slightly different from the standard EEG reports our hospital generated. Carla noticed the way I was staring at the screen. You're doing that thing, she said. What thing? The one where you start hunting for problems. I'm not hunting. She nodded toward the monitor over Madison's bed. You saw the heart rate change. That's not proof of anything. No, Carla said. But it got your attention. I leaned back slightly in the chair. In critical care, attention is a limited resource. Every hour of every shift, dozens of things compete for it. Alarms go off. Labs come back abnormal. Nurses ask for orders. Most of the time, your brain filters out 90% of it. The trick is recognizing when something small deserves to break through that filter. I glanced back at the medication record. The propofol entry still bothered me. Carla, I said, do you remember who was on shift the day this exam was done? She shrugged. That was months ago. I scrolled further down the chart until I found the physician's signature. Dr. Aaron Bell, Neurology Chief. Carla saw the name too. Well, she said, if Bell signed off on it, administration's going to treat that like gospel, probably. He's not exactly famous for second-guessing himself. I closed the EEG file and looked toward Madison again. Her breathing continued through the ventilator with mechanical regularity. The heart monitor showed a steady rhythm. No changes, no spikes, nothing unusual. Carla glanced between me and the patient. You're thinking about doing something, she said. I stood up slowly. Maybe. She shook her head. Dana. This case has been fought over for months, I know. You poke at it again and you're going to wake up Neurology Administration and probably legal. That's also true. She looked at Madison. Then she looked at Admiral Cross. The Admiral was still standing beside the bed. He hadn't moved much during our conversation. Just watching his daughter the way people do when they've been doing it for a long time. Carla lowered her voice. You really think there's something there? I didn't answer immediately. Instead, I remembered something from years earlier. A dusty trauma tent in Afghanistan. Limited equipment. Patients arriving faster than imaging machines could handle. When you don't have CT scanners or neurologists nearby, you rely on simpler tests. Crude sometimes, but surprisingly useful. Carla saw the change in my expression. Oh no, she said. You're remembering something. Maybe. What kind of something? I walked over to the bedside and studied Madison's face. Her eyelids were still. Her pupils showed no obvious reaction under the low ICU lighting. Everything about her presentation matched the diagnosis written in the chart, except for 2 tiny heart rate changes. I reached for the chart terminal again and checked the timestamp of the last neurological assessment. No repeat exam had been documented in months. Carla stepped closer to the bed. Dana, she said quietly. What are you thinking? I rested my hand on the rail of the bed. I'm thinking that before we assume the chart is right, I said, I'd like to check something myself. I moved my hand from the bed rail to the side of Madison's head and studied the area just behind her ear. Carla noticed exactly where I was looking. Oh, she said under her breath. You're not serious. I'm just checking something. That's what people say right before they wake up neurology at 3 in the morning. I ignored the comment and leaned slightly closer to the patient. There's a narrow area just behind the ear where a branch of the greater auricular nerve runs close to the surface. It isn't something we normally test in an ICU neurological exam. In most hospitals, the standard Brainstem tests focus on pupils, corneal reflex gag response, and respiratory drive. But years ago, when I was working in a forward trauma unit overseas, we sometimes used that spot as a quick stimulus point. The idea was simple. If any brainstem activity remained even weakly, that nerve could sometimes trigger a measurable reaction. It wasn't magic. It was just a crude field test developed for places where neurologists and imaging equipment weren't available. Carla watched my hand hover there. "You're really doing this," she said. "Just a light stimulus." "Dana, if Belle walks in here and sees you experimenting on a disputed brain death case, I'm not experimenting." She sighed. "You're about to." I placed 2 fingers lightly behind Madison's ear and applied gentle pressure. Nothing happened. The monitor above the bed continued its steady rhythm. Carla exhaled. "See," she said. "Artifact earlier." I nodded. "Probably." But I didn't move my hand right away. Instead, I released the pressure and waited a moment. Admiral Cross had turned slightly toward us. He hadn't said anything during the last few minutes, but it was obvious he was watching closely. "What are you checking, Doctor?" he asked quietly. "Just a reflex point," I said. He studied my expression. Something new. Something old, actually. He didn't ask anything else. Carla leaned closer to the monitor. "You're going to try it again," she said. "Once more." She shook her head slowly. "I'm going to regret being on this shift." I placed my fingers behind Madison's ear again. Same spot. Same pressure. The monitor line flickered. Then the heart rate climbed by 4 beats. Carla's eyes snapped to the screen. "Okay," she said. We both watched the numbers settle back down. Neither of us spoke for a few seconds. Admiral Cross stepped closer to the bed. "What was that?" he asked. "Probably electrical noise," Carla said quickly. She looked at me while she said it the way nurses do when they're trying to steer a situation away from something complicated, but I wasn't looking at the heart rate. I was watching the waveform itself. Electrical noise usually creates irregular spikes. This change had been smooth, gradual, physiological. Carla noticed the way I was studying the screen. "Don't," she said quietly. "I'm just observing. You're about to call neurology. I haven't decided that yet." She pointed toward the clock on the wall. "It's 3 in the morning. That's when neurologists do their best thinking." She gave me a flat look. "That's not true, and you know it." I removed my hand from behind Madison's ear and folded my arms. For a moment, the room returned to its quiet baseline. Ventilator cycling, monitors humming, Admiral Cross watching his daughter. Then he spoke again. "Madison," he said softly, "if you can hear me, squeeze my hand." His voice was calm. Not dramatic. Just the kind of thing a parent says after months of sitting beside a hospital bed. The heart rate climbed again. 3 beats, then 4. Carla looked at the monitor. Then she looked at me. "You see that too," she said. "Yes. Could still be coincidence." "Could be." Admiral Cross didn't look at the screen. He was still watching Madison's face. "Doctor," he said, "do you think she can hear me?" "That's not something I can answer yet." He nodded once. Carla stepped closer to the workstation and pulled up the live waveform. "Let's assume for a second this isn't noise," she said quietly. "Okay. What does that mean?" "It means we should confirm the neurological exam." Carla groaned softly. "Dana, that's standard procedure if something doesn't match the chart. You're about to wake up Aaron Bell." That thought had crossed my mind. She rubbed her forehead. "You know how this ends." "I know how it usually ends. Bell walks in here, runs the same tests, proves the diagnosis is correct, and then administration asks why we disturbed half the hospital. That's possible. And if you're wrong," Carla continued, You're the attending who questioned a months-old determination in the middle of the night. I looked at the monitor again. Madison's heart rate had returned to baseline. Quiet. Predictable. Exactly what everyone expected, except for those two small reactions. Carla followed my gaze. You're not letting this go, are you? I shook my head once. No, she sighed. Of course you're not. Admiral Cross stepped a little closer. What happens now? He asked. I considered the answer for a moment. In medicine, the next step is usually obvious, but obvious doesn't always mean comfortable. Calling neurology meant reopening a case that had already been debated for months. It meant challenging documentation signed by one of the most senior specialists in the hospital. It meant inviting administrators into a situation they thought had already been settled. Carla saw the decision forming on my face. You're really doing it, she said. I think we need another neurological evaluation. She glanced toward the door of the ICU. This place is going to get very busy very fast. Probably. Admiral Cross looked between us. You're saying the diagnosis might be wrong. I'm saying we need to confirm it. He studied me for a moment. Then he nodded. Do what you need to do. Carla turned back to the workstation. All right, she said. Let's wake up neurology. I picked up the phone beside the computer and dialed the consult line. The call connected after 2 rings. This is Dr. Whitaker in the ICU, I said. I need neurology down here for a repeat brainstem evaluation. The receiver clicked softly as the consult line connected, and I repeated the request for a neurological evaluation. The resident on call paused for a second. You're calling about the Cross case, he asked. That's right. Another pause. Hold on. I waited with the phone against my ear while Carla leaned against the workstation and watched Madison's monitor. Admiral Cross remained beside the bed, one hand resting on the railing. After a moment, a different voice came on the line. Older. Tired. Slightly irritated. This is Bell. Dr. Aaron Bell was the chief of neurology at Ridgeview. If a neurological determination had been signed in this hospital, there was a good chance his name was somewhere on the paperwork. Dr. Bell, I said. Dana Whitaker in the ICU. I know who you are, he said. Why are we reopening this case at 3 a.m? I'm seeing heart rate changes associated with verbal stimulus from the patient's father. That's not evidence of neurological activity. I agree, I said, but I'd like a repeat brainstem exam. Silence hung on the line for 2 seconds. You're aware this patient has a documented determination of brain death under review? Yes. And you're also aware that 2 separate physicians signed that determination? I read the chart. Another pause. Then Bell sighed. You're chasing noise on a monitor. That's possible, I said. But confirmation would settle it. Carla raised an eyebrow from across the room. She could hear Bell's voice faintly through the phone. Bell spoke again. Has anything changed in the patient's condition? No. Any spontaneous respiration? No. Any movement? Not that I've observed. So what exactly triggered this sudden curiosity? I glanced at the monitor again. Subtle heart rate changes when the father speaks. Bell let out a short breath that sounded halfway between a laugh and a groan. Doctor. If heart rate fluctuations meant neurological recovery, half the ICU would be resurrecting itself every night. I'm aware of that. Then you understand why this sounds unnecessary. I understand, I said. But I'd still like neurology to take a look. The line went quiet again. Carla whispered from the counter, has deciding how annoyed he wants to be. She was probably right. Finally, Bell spoke. Fine, he said. I'm on my way. The call ended. Carla exhaled slowly. Well, she said that went better than expected. Give it time. How long? About 10 minutes. She laughed quietly. Bell hates being wrong more than he hates being woken up. Admiral Cross had been listening to the conversation without interrupting. Doctor, he said, what does this exam involve? Standard neurological reflex tests, I said. Pupil response, corneal reflex, gag reflex. Things that indicate brainstem function. And if those responses are present, then the previous determination would have to be reconsidered. He nodded slowly. The ventilator cycled again. Madison remained still. For a few minutes, the room returned to the calm rhythm that defines most ICU nights. Carla checked the IV lines. I reviewed the chart again, scrolling through the earlier documentation to make sure I hadn't missed anything obvious. The chart looked the same as before. Clean entries, clear conclusions. The kind of documentation administrators love because it gives the impression that everything happened exactly the way it should. Footsteps approached down the hallway outside the ICU. Carla glanced toward the door. "Here we go," she said. Dr. Aaron Bell stepped into the room, wearing a wrinkled button-down shirt under his white coat. His hair looked like it had been flattened by a pillow 10 minutes earlier. He stopped beside the bed and glanced at the monitor. "You woke me up for this?" he asked. "Thanks for coming," I said. He didn't respond to the politeness. Instead, he picked up the chart tablet and skimmed through the entries with the speed of someone who already believed he knew the answer. "You're concerned about heart rate changes," he said. "Yes." Bell looked at Madison. "She's been on a ventilator for 6 months with no neurological response." "I know." He glanced at Admiral Cross. "Sir," he said, "I understand this situation has been difficult for your family, but we've already established the neurological findings." Admiral Cross didn't raise his voice. "I'm aware of that, Doctor." Bell nodded once and turned back to me. "So let's address the question directly." He gestured toward the monitor. "You're seeing minor fluctuations in heart rate when the father speaks." "Yes. That can happen for a number of reasons unrelated to brain activity." "I agree. So we're here to confirm that the original exam still stands." "That's correct." Bell studied me for a moment. "Is there anything else you've observed?" I hesitated briefly. Carla noticed. "Dana also tried a stimulus point behind the ear," she said. Bell's eyebrows lifted. "A what?" "A cranial nerve stimulation technique," I said. Bell stared at me. "That's not part of a standard ICU exam." "It isn't. Where exactly did you learn it? Trauma work overseas?" Bell folded his arms. "And what did this technique supposedly show? 2 small increases in heart rate." He shook his head. "That's meaningless." "Probably. But it made you curious." "Yes." Bell stepped closer to the bed. "All right," he said. "Let's walk through this again." He reached for a pen light from his pocket and lifted one of Madison's eyelids. The beam of light passed over her pupil. Carla watched closely. Admiral Cross stood perfectly still. Bell moved the light from one eye to the other. Then he stepped back slightly. "Pupils, non-reactive," he said. Exactly what the chart predicted. He placed the pen light back in his pocket and reached for a sterile cotton swab from the bedside tray. "This is the corneal reflex test," he said. Bell gently touched the surface of Madison's eye. We all watched. Normally, even in unconscious patients, the eyelid will blink. Madison didn't move. Bell nodded once. "No corneal reflex?" Carla glanced toward me. The results so far matched the chart perfectly. Bell tossed the swab aside and reached for a tongue depressor. "Next is the gag reflex." He positioned the depressor carefully and applied light pressure. For a moment, nothing happened. Then Madison's throat moved slightly. It was subtle, barely noticeable. Bell froze. Carla leaned forward. "Did you see that?" she asked quietly. Bell didn't answer right away. Instead, he repeated the test with slightly firmer pressure. Madison's throat contracted again. Bell slowly lowered the tongue depressor and looked up at the monitor. Then he looked at me. "That shouldn't be there," he said quietly. Bell held the tongue depressor still for a moment, staring at Madison's throat, like the movement might undo itself if he waited long enough. Carla was the first to speak. "That was a gag reflex," she said quietly. Bell didn't answer. Instead, he repeated the test again, this time slightly deeper. Madison's throat contracted a second time. Subtle but unmistakable. Bell slowly pulled the depressor back and dropped it into the tray. "That shouldn't be there," he said again. Admiral Cross stepped closer to the bed. "What does that mean?" Bell turned toward him, but the usual certainty in his voice was gone. It means we need to repeat the full exam. Carla folded her arms. That's what we're doing? Bell ignored the comment and walked to the foot of the bed where the ventilator display was mounted. He checked the settings, scanned the oxygen saturation, then looked at the respiratory waveform. Ventilator hasn't changed, he muttered. No, I said. Sedation. None for months. He nodded once. Then he turned back toward the bed. The brainstem controls basic reflexes like breathing, swallowing, and gag response, he said. If that reflex is present, the previous determination becomes questionable. Admiral Cross absorbed that slowly. You're saying she might not be brain dead? Bell didn't like answering that question. He rubbed his forehead and looked back at Madison. I'm saying the exam results don't fully match the original documentation. Carla raised an eyebrow. That's a very polite way of putting it. Bell gave her a look that suggested humor wasn't appreciated at the moment. I stepped closer to the bed. Let's continue the exam. Bell nodded. He picked up the penlight again and leaned over Madison's face. This time he watched more carefully. He shined the beam across her pupil again. Still no response. But something about the way he was watching had changed. Now he wasn't looking for confirmation. He was looking for inconsistencies. Carla leaned toward the monitor. Heart rate's climbing again, she said. Admiral Cross spoke softly near Madison's ear. Madison. The heart rate rose 3 beats. Bell noticed. Is that happening every time he talks? Almost every time, I said. Bell studied the waveform. Autonomic responses can occur without consciousness, he said. I know. But that still doesn't explain the gag reflex. No. The room was quiet except for the ventilator. Bell reached for another swab. Corneal reflex again. He touched Madison's eye carefully. Nothing. No blink. Carla leaned back slightly. So pupils, non-reactive corneal absent gag present. Bell nodded. That combination doesn't fit brain death. Admiral Cross looked at his daughter again. What does it fit? Bell didn't answer immediately. He glanced toward me instead. You mentioned a nerve stimulation behind the ear. Yes. Show me. Carla groaned softly. Oh, great. I stepped to the head of the bed again and placed my fingers behind Madison's ear at the same point as before. Bell watched closely. That's along the greater auricular nerve, he said. Exactly. I applied the same gentle pressure. The heart rate climbed again. 4 beats this time. Bell looked at the monitor. Interesting. Carla leaned forward. That word coming from neurology means this just got complicated. Bell ignored her. Try it again. I released the pressure and waited a few seconds, then repeated it. Another heart rate increase. Bell nodded slowly. That's reproducible. Admiral Cross spoke quietly. Doctor, what does that mean? Bell looked at him carefully. It means there may still be some brainstem activity. The Admiral's grip tightened on the bed rail. For 6 months, they've been telling me she's gone. Bell looked uncomfortable. I'm not ready to say that the diagnosis was wrong yet, but you're not ready to defend it either, Carla said. Bell shot her a warning look. This is a complicated case. Carla shrugged. Most interesting cases are. Bell walked toward the workstation and pulled up the original EEG file. Let's review the studies again. I joined him at the screen. Carla stayed near the bed with Admiral Cross. Bell scrolled through the scanned EEG report. Flatline pattern, he said. Consistent with severe brain injury. But it's a scan, I said. Yes. Not the original waveform. Bell frowned slightly. You're suggesting the raw data should be reviewed. Yes. He leaned closer to the screen. This report came from an outside lab. That's what the header says. Bell tapped the monitor. But the formatting isn't typical. I nodded. That caught my attention earlier. Carla called from the bedside. Heart rate again. Bell turned. Admiral Cross had leaned closer to Madison. I'm here, sweetheart, he said softly. The heart rate rose. Bell stared at the monitor. That's not random. No, I said. Carla looked between us. So what are we thinking now? Bell didn't answer immediately. Instead, he looked back at the chart and opened the documentation for the second confirmatory exam. He scanned the page carefully. Then his eyes stopped moving. What's wrong? I asked. Bell leaned closer to the screen. The timestamps. I stepped closer. The exam time and the medication record were visible side by side. Carla walked over as well. What about them? She asked. Bell pointed at the line. The apnea test was documented before the sedation clearance note. Carla frowned. That's backwards. Bell nodded slowly. Yes. Admiral Cross was watching all of us now. You're saying the test may not have been valid. Bell hesitated. I'm saying the documentation doesn't make sense. Carla folded her arms. In medicine, that usually means someone messed up. Bell looked at the chart again. Or worse. He leaned back slowly from the screen. If these timestamps are accurate, he said quietly, then the original brain death determination should never have been finalized. Bell leaned closer to the screen and scrolled back through the documentation again, slower this time. Carla stood beside him with her arms crossed, watching the timestamps like she was waiting for them to rearrange themselves. They didn't. The sedation clearance note is logged at 14:18, Bell said. I nodded. And the apnea test begins at 14:11. Carla tilted her head. So the patient was supposedly tested for brain death 7 minutes before the record says sedation had cleared. Bell looked at her. That's impossible. Admiral Cross had moved a few steps closer to the workstation. What does that mean? He asked. Bell didn't answer immediately. Instead, he opened another part of the chart and scanned the medication administration record again. The propofol infusion stop time was still sitting there on the screen. Carla leaned closer. Maybe it's a charting delay. Maybe, Bell said. But he didn't sound convinced. In hospitals, charting delays happen all the time. But brain death exams are different. They're one of the most tightly documented procedures in medicine. Every step is supposed to be carefully timed and confirmed because the diagnosis carries enormous legal weight. Bell pulled up the physician note from the second confirming exam. The document listed the attending neurologist who had verified the findings. Dr. Michael Sato. Carla frowned slightly. Sato wasn't even working here 6 months ago, she said. Bell looked at her sharply. What do you mean? He transferred to Northbridge in late spring. Bell checked the timestamp again. This exam was documented in early March. Carla shrugged. Then he must have left right after. Bell didn't look satisfied with that explanation. He clicked open the physician roster archive and scanned the list of staff assignments for that week. Carla leaned over his shoulder. What are you checking, shift records? A moment passed. Then Bell stopped scrolling. That's strange. What Sato wasn't on call that day. Carla blinked. Not even covering Bell shook his head. No. Admiral Cross looked between us. You're telling me the doctor who confirmed my daughter's death wasn't even here, Bell rubbed his forehead. I'm telling you the shift record doesn't show him in the hospital that day. Carla let out a slow breath. That's not good. Bell kept staring at the screen. There are a few possible explanations. Let me guess, Carla said. Charting error again. That's one possibility. What are the others? Bell didn't answer immediately. Instead, he opened the imaging records and searched for Madison's CT scans. The first one appeared on the screen. Head trauma from the climbing accident had caused severe swelling around the brainstem region. Carla studied the scan. That swelling could definitely knock someone out for a long time. Yes, Bell said. But brain death requires complete absence of function. I leaned closer. What about compression? Bell zoomed in slightly on the image. The brainstem area is tight, he said, but the scan resolution isn't perfect. Carla glanced toward Madison's bed. So if that pressure improved over time, some reflexes could theoretically return. Admiral Cross's voice was calm but tight. You're saying she might have been alive this entire time. Bell looked at him carefully. I'm saying the evidence no longer supports the original conclusion with certainty. Carla gave a quiet whistle. That's the kind of sentence administrators hate. Bell nodded, especially when it involves a 6-month ICU case. The ventilator continued its steady rhythm behind us. Admiral Cross walked back to Madison's bedside and rested his hand near hers. He didn't say anything. He just watched her face. Bell turned back to the computer. I want the original EEG data, he said, not the scanned report. Carla raised an eyebrow. You think the waveform might tell a different story? Possibly. Where would the raw data be? Bell pulled up the imaging database. If it was done in-house, it would be here. He typed quickly, searching the system. Nothing appeared. Carla leaned forward. Try the outside lab. Bell entered another query. Still nothing. That's odd, he said. Maybe it was archived, I suggested. Maybe. Carla crossed her arms again. This case is getting messy. Bell nodded slightly. The more complicated part is what happens if the original determination is invalid. Admiral Cross spoke quietly from the bedside. What happens? Bell looked at him. Then legally your daughter was never brain dead. Carla looked toward Madison. And we've had a conscious patient in long-term ICU care without anyone realizing it. Bell didn't respond to that. He continued reviewing the chart, moving from one section to another. Medication logs, progress notes, consult entries. Each piece looked normal by itself, but together they formed a pattern that felt slightly off. Carla noticed Bell's expression. You're seeing it too, aren't you? Bell nodded. Yes. The documentation is too clean. Carla laughed softly. That's the first time I've heard a doctor complain about tidy records. In complicated cases, Bell said the chart usually shows disagreement. Different opinions, questions, but this one doesn't. No. Admiral Cross turned slightly toward us. You're saying nobody questioned the diagnosis? Bell hesitated. That's what the chart suggests. Carla looked toward Madison again. And yet she's showing a gag reflex and heart rate responses. Bell nodded. That's the problem. He leaned back from the workstation and folded his arms. We need fresh imaging. What kind, I asked. CT angiography if possible. Carla glanced at the clock. It's almost 4 a.m. Yes. And radiology loves emergency scans that challenge months-old conclusions. Bell gave a tired half smile. They'll survive. Admiral Cross stepped closer to us. If the scan shows activity, he said quietly, what happens then? Bell looked directly at him. Then we stop treating your daughter as a brain-dead patient. Carla looked back toward the bed. And we start treating her like someone who might still be in there. Bell nodded slowly. But his attention returned to the chart again. He scrolled back to the physician's signatures. Then he froze. What now? Carla asked. Bell pointed at the electronic signature line. Look at the time. I leaned closer. The signature for the second confirmatory exam had been entered at 03:12. Carla frowned. That's odd. Why? Admiral Cross asked. Bell turned slightly toward him. Because according to the shift record, he said quietly, Dr. Sato didn't arrive at the hospital until after 5 that morning. Bell kept staring at the timestamp for several seconds before he finally leaned back from the workstation. Carla broke the silence first. So either the hospital invented time travel, she said, or someone signed a neurological death exam before they even showed up for work. Bell rubbed his eyes. Let's not jump to conclusions. Carla shrugged. Sure. Let's just say it's very strange. Admiral Cross stepped closer to the workstation. Doctor, he said quietly, I need to understand something clearly. Bell turned toward him. Yes, Admiral. If the doctor who confirmed my daughter's death wasn't even in the hospital at that time, what does that mean? Bell hesitated. In medicine, hesitation often means the truth is uncomfortable. It means the documentation doesn't line up with the staff records, he said carefully. Carla snorted softly. That's a very diplomatic way of saying the paperwork might be garbage. Bell shot her a look, but didn't argue. Instead, he turned back to the computer and opened the radiology ordering screen. "We need new imaging," he said. "What kind?" I asked again. "CT angiography of the brain." Carla glanced toward Madison. "That checks blood flow." "Yes. And if there's blood flow," Bell met her eyes, "then the brainstem is still receiving oxygen." Admiral Cross slowly walked back toward the bed and rested his hand on Madison's shoulder. "Then do the scan," he said. Bell nodded once. "I'm ordering it now." He typed quickly and sent the request through the system. Carla watched the screen. Radiology's going to ask questions. They always do. And administration. They'll find out eventually. Carla leaned against the counter again. "You realize what this looks like if the original diagnosis was wrong." Bell didn't answer. But we all knew. Hospitals handle mistakes quietly when they can. But a brain death determination carries enormous consequences. Families make decisions based on it. Insurance policies change. Life support conversations happen. If the diagnosis was wrong, even by accident, it meant the system had failed at one of the most critical moments in medicine. A few minutes later, the ICU phone rang. Carla picked it up. "ICU." She listened for a moment. "Yes, that's correct." Another pause. "Stat order from Neurology." She glanced toward Bell. "They're asking if this is real." Bell stepped closer and took the phone. "Yes," he said. "It's real." He listened briefly, then nodded. "Prepare the scanner. We're bringing the patient down." He hung up. Carla raised her eyebrows. "That was faster than I expected." "Radiologists are curious people," Bell said. "Especially when someone challenges a brain death case." Admiral Cross watched as Carla began preparing Madison's lines for transport. "Is it safe to move her?" he asked. Carla nodded. "She's stable." Bell checked the ventilator connections. "We'll bring a portable monitor and ventilator." Carla adjusted the IV pumps. "I'll call transport." A few minutes later, 2 orderlies arrived with the ICU transport stretcher. Madison's bed was carefully disconnected from the wall monitors and transferred to the portable system. The ventilator tubing was switched to a mobile unit. The room filled with the quiet efficiency of hospital staff performing a routine task. But there was nothing routine about the tension in the air. As we rolled the bed into the hallway, Admiral Cross walked beside it, never more than a step away from his daughter. Carla pushed the IV pole. Bell walked ahead, reviewing the imaging order on his phone. The radiology corridor was brightly lit even at 4 in the morning. The CT technician was already waiting when we arrived. He looked at the chart briefly and raised an eyebrow. "This is the Cross case," he said. Bell nodded. "Repeat scan." The technician didn't ask further questions. In hospitals, people learn quickly when something important is happening. Madison was transferred onto the CT table with practiced care. The ventilator continued its steady rhythm as the scanner arm rotated into position. Carla stood near the control room window. Admiral Cross stood beside her. Bell joined the technician at the console. "CT angiography protocol," he said. The technician nodded. "Contrast ready." The scanner began its quiet mechanical rotation. Inside the control room, we watched the images appear one by one on the monitor. Layer after layer of brain tissue came into view. Carla leaned forward slightly. "What are we looking for?" she asked. "Blood flow," Bell said. The technician adjusted the contrast settings. Color-coded patterns began appearing on the screen. Admiral Cross didn't understand the details of what he was seeing, but he could read the tension in the room. Bell stared at the screen without blinking. Carla watched his face. "What do you see?" Bell didn't answer immediately. Instead, he zoomed in on the brainstem region. The technician leaned closer. "Is that?" Bell raised a hand. "Wait." Another image appeared. Then another. Carla looked from the screen to Bell. Dr. Bell finally spoke. "There's perfusion." Carla blinked. "Blood flow, yes." Through the brainstem, Bell nodded slowly. "That's what it looks like." Admiral Cross gripped the edge of the control room counter. "What does that mean?" Bell turned toward him. "It means your daughters, Brainstem is receiving oxygen. Carla exhaled softly. So the brain isn't dead. Bell didn't soften the statement. No, he said, it isn't. The technician looked between us. You realize what this means, right? Bell nodded. Yes. The technician glanced back at the scan. Someone signed a brain death determination while the brain was still perfused. Bell folded his arms. That's exactly what it means. Carla stared at the monitor. 6 months. Admiral Cross closed his eyes briefly. Then he opened them again and looked at the scan. She's still alive. Bell didn't contradict him. Instead, he studied the imaging carefully. The perfusion pattern wasn't strong, but it was there. Subtle, unmistakable. Bell turned toward me. We need an EEG immediately. Carla raised an eyebrow. Tonight, yes. Because if the brainstem is alive, Bell finished the thought quietly, then consciousness may still be possible. Admiral Cross looked through the glass window at Madison lying on the CT table. For the first time in 6 months, the certainty that had surrounded her diagnosis was gone. And in its place was something far more dangerous. Hope. The CT scanner powered down with a low mechanical hum, and the last set of images froze on the monitor in the radiology control room. Bell didn't move for a moment. He was still staring at the perfusion map of Madison's brainstem like he expected it to disappear if he blinked. Carla broke the silence. So the brain's getting blood. Bell nodded slowly. Yes. That alone disqualifies a brain death diagnosis. Yes. The CT technician leaned back in his chair. I've been doing scans here for 12 years, he said. I've never seen a case reopen like this. Bell didn't respond. Instead, he picked up his phone and began typing. What are you doing? Carla asked. Ordering an emergency EEG. Carla glanced through the window at Madison lying on the scanner table. You're looking for electrical activity. Bell nodded. If there's any cortical signal at all, we need to know immediately. The technician pointed at the imaging screen. With perfusion like that, I'd expect at least some signal. Bell didn't say anything, but his eyes said he was thinking the same thing. Carla turned toward Admiral Cross. We're moving her back upstairs, she said gently. The Admiral nodded. Whatever needs to happen. Madison was transferred carefully back onto the transport stretcher. The ventilator was reconnected to the portable unit, and the IV lines were secured again. As we rolled her down the hallway toward the ICU, the building felt different. Hospitals at night are usually quiet. But sometimes quiet doesn't mean calm. Sometimes it means something important is about to change. Back in the ICU, the room filled quickly with equipment. The EEG technician arrived within 15 minutes carrying a compact cart full of electrodes and cables. He looked at Bell. You're serious about this case? Yes. The technician glanced toward Madison. Brain death review. Bell nodded. Possible reversal. The technician whistled quietly. Well, he said that's not something you see every week. He began attaching the electrodes across Madison's scalp with practiced speed. Carla stood nearby watching the monitor while Admiral Cross remained beside the bed. The Admiral hadn't said much during the trip back from radiology, but his eyes had changed. Earlier that night, they had looked like someone who had already accepted the worst outcome. Now they looked like someone who wasn't willing to lose again. The technician finished securing the final electrode. All right, he said. He powered on the EEG machine. The monitor lit up with a black background and thin white lines that began scrolling across the screen. At first, the lines were almost flat. Carla leaned closer. That doesn't look promising. Give it a second, the technician said. Bell stood beside the machine, watching carefully. Admiral Cross looked between the screen and his daughter. What exactly are we looking for? He asked. Bell answered quietly. Electrical activity from the brain. The lines on the screen continued scrolling. Slow, subtle. Then one of the channels flickered. Carla blinked. Did that move? The technician leaned forward. Let me adjust the gain. He changed the sensitivity slightly. The lines became clearer. Bell pointed at one section. There, a faint wave appeared across two of the channels. Not strong, but definitely not flat. The technician stared at the monitor. That's cortical activity. Carla exhaled slowly. So she's not brain dead. Bell didn't soften the answer. No. Admiral Cross gripped the edge of the bed rail. Is she conscious? Bell shook his head. Not necessarily. The technician pointed at the screen again. This pattern could indicate minimal brain activity, possibly a very low level of awareness. Carla looked toward Madison. 6 months of being treated like she wasn't there. Bell kept watching the EEG. Let's see if we can provoke a response. The technician nodded. Stimulus test, yes. Carla stepped closer to the bed. What kind? Bell looked toward Admiral Cross. Sir, I'd like you to speak to your daughter again. The Admiral leaned toward Madison's ear. Madison, he said quietly. It's Dad. The EEG lines shifted. Small waves appeared across 3 channels. The technician's eyebrows lifted. There it is. Carla looked at the screen. That's definitely not noise. Bell leaned closer. Repeat it. Admiral Cross swallowed. Madison. The waveforms grew slightly stronger. Carla stared at the monitor. She hears him. Bell nodded slowly. That's consistent with auditory processing. The technician leaned back. She's responding to voice. Carla glanced at Madison's face. She hasn't moved. Bell shook his head. She may be unable to move. Admiral Cross looked confused. What does that mean? Bell chose his words carefully. It means her brain may be aware, but her body may not be able to respond. Carla understood immediately. Locked-in syndrome. Bell nodded. That's one possibility. The Admiral's face went pale. You're telling me my daughter might have been conscious this whole time? Bell didn't rush the answer. It's possible she's had some level of awareness. Carla looked down at Madison. 6 months of hearing people talk about her like she wasn't alive. The EEG technician adjusted the recording. Let's try another stimulus. Bell nodded. Dana, he said, looking at me. Try that nerve point again. I stepped to the head of the bed and placed my fingers behind Madison's ear in the same spot as before. The moment I applied pressure, the EEG waveform changed. 3 channels showed a small burst of activity. Carla looked at the monitor. That's a response. The technician nodded. Clear as day. Bell folded his arms slowly. She's processing stimulus. Admiral Cross leaned over his daughter again. Madison, if you can hear me, squeeze my hand. The room became perfectly still. Carla watched Madison's fingers. Nothing happened for a moment. Then one of Madison's fingers twitched. Just once. Small, but deliberate. Carla gasped softly. Bell stared at the hand. That wasn't a reflex. Admiral Cross whispered her name again. The finger moved a second time. The technician looked at the EEG monitor. That movement matched the signal spike. Carla shook her head in disbelief. She's trying to communicate. Bell slowly straightened. The certainty that had surrounded Madison's case for 6 months was gone. The hospital had labeled her brain dead, but the evidence now told a completely different story. Madison Cross was still there, still aware. And for the first time since her accident, the people in the room were finally beginning to hear her. Madison's fingers settled back onto the sheet, and for a few seconds, nobody in the room said anything. The EEG monitor continued its quiet rhythm beside the bed. Bell was still staring at Madison's hand. Carla broke the silence. That wasn't a reflex, she said again. Bell nodded slowly. No. The EEG technician leaned closer to the screen. The movement lined up exactly with the signal spike. Admiral Cross looked between the monitor and his daughter. Madison, he said softly, if you can hear me again, squeeze my hand. He wrapped his fingers gently around hers. For a moment, nothing happened. Then Madison's hand tightened slightly. Carla covered her mouth. Bell exhaled. That's purposeful movement. The technician nodded. She's following a command. Admiral Cross lowered his head toward Madison's forehead and rested it there for a second. He didn't cry. He didn't shout. But the relief in his voice was unmistakable. She's still here. Carla glanced at Belle. So we can officially say she's not brain dead. Belle nodded. Yes. The EEG technician printed the recording strip and handed it to Belle. This is solid evidence, he said. Belle studied the printout carefully. The waveforms clearly showed electrical activity corresponding to the verbal commands. Carla leaned against the counter. You realize what this means for the hospital. Belle looked at her. Yes. Admiral Cross lifted his head. What does it mean? Belle hesitated for a moment before answering. It means the original brain death determination was incorrect. Carla crossed her arms. And that determination is sitting in her medical record. The room was quiet again. Madison's ventilator continued its steady cycle. Belle looked back in the workstation. We need to review the documentation again. Carla followed him to the computer. Admiral Cross stayed beside the bed. Belle opened the electronic chart and navigated to the brain death determination form. The document filled the screen. 2 signatures. 2 confirmatory exams. Clear language stating the patient had no neurological function. Carla leaned closer. That form triggers a lot of downstream decisions. Belle nodded. Yes. What kind life support discussions, insurance classifications, potential organ donation evaluation? Carla shook her head slowly. And none of it should have happened. Belle didn't argue. Instead, he opened the timestamps again. The sedation clearance note still appeared after the apnea test. The confirming physician still appeared to have signed the exam hours before arriving at the hospital. Carla tapped the screen. That's not just sloppy. No. Belle scrolled down to the physician's signature. Dr. Michael Sato. Admiral Cross looked toward the screen. Who is that? Belle answered carefully. A neurologist who worked here earlier this year. He transferred to another hospital. Carla looked at Belle. You think he actually signed this? Belle shook his head slowly. I don't know. Carla pointed at the timestamp again. He couldn't have. Belle nodded. That's what the shift record suggests. Admiral Cross stepped closer to the workstation. So someone entered his name. Belle didn't respond right away, but his silence was enough. Carla exhaled slowly. Someone forged a confirmation on a brain death determination. Belle rubbed his forehead. That's a serious accusation. Carla shrugged. So is declaring a living patient dead. Admiral Cross's voice was calm. What happens now? Belle closed the chart window and folded his arms. Now we document everything that happened tonight. Carla raised an eyebrow. That's the polite answer. Belle looked at her. The realistic answer is that administration will get involved. Carla nodded. That's the part I was expecting. Belle glanced at the EEG printout in his hand. This evidence needs to be added to the chart immediately. He turned back to the computer and began typing a new note. Carla leaned against the counter again. You're going to get a phone call in about 10 minutes. Belle didn't look up. I'm aware. Admiral Cross returned to Madison's bedside and sat in the chair beside her. He held her hand again. Madison's fingers moved slightly in response. Carla noticed. She's still following commands. Belle glanced at the EEG monitor. Minimal, but consistent. The technician finished saving the recording files. I'll upload the raw data to the system, he said. Belle nodded. Please do. The technician packed up part of his equipment but left the electrodes attached. You might want continuous monitoring for a while. That's the plan, Belle said. A few minutes passed quietly. The ICU returned to its usual nighttime rhythm. But the mood in the room had completely changed. Earlier that night, Madison Cross had been documented as a patient with no brain activity. Now she was responding to commands. Carla looked toward Belle. You know administration's not going to like this. Belle finished typing the note and signed it electronically. No. And once they see the chart discrepancies, They'll investigate. Carla shook her head. This is going to get messy. Admiral Cross spoke quietly from the bedside. I'm less concerned about messy than I am about honest. Bell looked at him. That's fair. Carla glanced toward the hallway. You hear that footsteps were approaching? Several pairs. Bell followed her gaze. That was faster than I expected. The ICU doors opened. 2 hospital administrators stepped into the room along with a representative from risk management. They stopped just inside the doorway, taking in the monitors, the EEG machine, and the cluster of staff around Madison's bed. The lead administrator looked at Bell. Dr. Bell, she said we were informed there's been a change in the Cross case. Bell didn't move. Yes, he said calmly. There has. The ICU doors closed behind the administrators, and the room shifted from clinical tension to something colder. Not panic, not anger, something quieter. The lead administrator, a woman in her early 50s named Karen Holt, stepped forward with a tablet tucked under her arm. Beside her stood a risk management officer and a junior legal advisor who looked far too awake for 4 a.m. Holt surveyed the room carefully before speaking. Dr. Bell, she said calmly, we received a message that the neurological status of patient Madison Cross has changed. Bell didn't move. That's correct. Holt glanced toward the EEG monitor and the electrodes still attached to Madison's head. Explain. Bell handed her the printed EEG strip. Electrical activity, he said, and purposeful movement. Holt studied the strip for several seconds. Carla leaned against the counter, watching the administrator read the waveform like it might suddenly translate itself into English. Finally, Holt looked up. You're saying the patient is not brain dead? Bell nodded. That is correct. The legal advisor shifted uneasily. But the chart clearly documents 2 confirming exams. Bell turned slightly toward the workstation. And the chart documentation contains inconsistencies. Holt's eyes narrowed. What kind of inconsistencies? Bell opened the medical record on the screen again. The sedation clearance time occurs after the apnea test. The risk manager leaned forward. That could be a documentation delay. Bell nodded. That's possible. Then he pointed at the confirming physician's signature. The second neurologist appears to have signed the exam at 3:12. Holt looked at the timestamp, and Bell turned the monitor slightly toward her. Shift records show that physician arrived at the hospital after 5 that morning. The legal advisor spoke quietly. So the exam may not have been properly confirmed. Carla folded her arms. That's one way to say it. Holt glanced toward Madison's bed. And the patient is now showing neurological response. Bell nodded again. Yes. Admiral Cross stood beside the bed with his hand wrapped around Madison's fingers. She responded to commands, he said. Holt turned toward him. Sir, I understand this situation must be extremely emotional. The Admiral didn't raise his voice. Emotion has nothing to do with EEG data. Carla smiled slightly. Bell returned his attention to the administrator. The CT angiography confirms brainstem perfusion. Holt looked back at the EEG strip. So the diagnosis of brain death cannot be maintained. That is correct. The room went quiet again. The legal advisor began typing something rapidly into a tablet. The risk manager whispered something to Holt. Carla leaned toward me slightly. Here comes the paperwork panic, she murmured. Holt straightened and spoke clearly. For the moment, Madison Cross will be reclassified as a critical neurological patient. Bell nodded. That's appropriate. And will initiate a formal review of the previous determination. Carla tilted her head. You mean an investigation? Holt didn't react to the wording. Well, determine exactly what occurred. Admiral Cross looked at her calmly. I'd appreciate that. Holt glanced again toward Madison. How responsive is the patient? Bell gestured toward the bed. Limited movement and auditory response. Holt turned toward the EEG technician. Is that documented? Yes, he said. Fully recorded. The administrator nodded once. Good. Madison's ventilator continued its steady rhythm. The EEG lines drifted slowly across the screen. Admiral Cross leaned closer to his daughter again. "Madison," he said quietly. The EEG waveform shifted slightly. Carla saw it first. "There it is again." Belle stepped closer. "Repeat the command." The Admiral squeezed Madison's hand gently. "Madison, if you hear me, move your fingers." For a moment, nothing happened. The EEG line flickered. Then Madison's hand moved again. Not much. Just a small tightening of her grip. But it was deliberate. Holt watched the movement carefully. "That's purposeful." Belle nodded. "Yes." Carla looked down at Madison's face. "You've been trying to talk for 6 months, haven't you?" The EEG technician adjusted the display slightly. "Signal activity is increasing." Belle leaned forward. "That could indicate improving awareness." Admiral Cross spoke again, his voice steadier now. "Madison." The EEG line shifted. Then something else happened. Carla leaned forward suddenly. "Hold on." Belle followed her gaze. Madison's eyelids moved. Just slightly. But enough to be noticed. The room went completely silent. Admiral Cross froze. Belle stepped closer to the bed. "Watch her eyes." Madison's eyelids fluttered once, then settled again. Carla whispered, "That wasn't random." Belle nodded slowly. "Try again." The Admiral leaned close to his daughter. "Madison." Another small movement. Her eyelids trembled again. The EEG waveform showed a clear burst of activity. Carla looked at Belle. "She's trying." Belle's voice was quiet. "Yes." Holt watched the scene without speaking. Madison's eyelids moved once more. Then slowly, unevenly, they began to open. The motion was weak, incomplete, but unmistakable. Her eyes struggled against the ICU lights for a moment before focusing weakly on the shapes above her. Admiral Cross inhaled sharply. "Madison." Her eyes shifted slightly toward the sound of his voice. Carla covered her mouth. "Oh my God." Belle exhaled slowly. "She's conscious." The EEG technician nodded. "Confirmed." Madison's gaze moved slowly across the room. Her breathing remained controlled by the ventilator. Her body still barely moved, but her eyes were awake. She looked toward her father again. Admiral Cross leaned close, his voice almost breaking. "I'm here." Madison's fingers tightened weakly around his hand. Belle glanced toward the administrator. "Well," he said quietly, "that answers the neurological question." The room remained still for several seconds. Madison Cross, who had been declared brain dead 6 months earlier, was looking at the people around her. And for the first time since the accident, everyone in the ICU understood the same thing. She had been there the whole time. In hospitals, people like to believe that medicine is always precise. Charts are clean. Diagnoses are certain. And once something is written in a medical record, it starts to feel permanent. But nights like this remind you that medicine is still practiced by human beings. Doctors make decisions based on the information they have. Nurses watch the details that machines can't explain. And sometimes the difference between the two is the moment when someone decides to look again instead of accepting the chart as the final word. Madison Cross spent 6 months in an ICU bed with a diagnosis that everyone believed was settled. Specialists had signed the forms. Policies had been followed. The paperwork looked complete. And yet the truth was still there waiting for someone to question it. That's one of the strange realities inside any hospital. The technology is powerful, but the most important tool is still attention. A nurse noticing a pattern. A doctor asking one more question. A team willing to double-check something that already feels finished. Real hospital stories like this don't happen because someone is trying to be a hero. They happen because someone refuses to ignore a small detail that doesn't make sense. Sometimes it's a monitor change. Sometimes it's a reflex that shouldn't exist. And sometimes it's a quiet voice in the back of the room saying, "Let's check one more time." For doctors and nurses, that instinct is part of the job. It's the difference between following the chart and truly seeing the patient. Stories like this are why hospital medicine is never just about machines or protocols. It's about people paying attention when it matters most. If you enjoy real doctors and nurses' stories like this, cases that happen behind the doors of real hospitals, make sure to subscribe to the channel. Every week, we share intense, true-to-life hospital stories that show what medicine really looks like when things don't go according to plan.